Hi, I'm Femi Oke and you're in the stream. Infected with one of the world's deadliest viruses, people are actually running away from doctors. Today, the challenges of tackling the Ebola epidemic in West Africa. So I'm tag teaming with my normal co-host Malika Bilal, who is off on vacation. Our digital producer today, though, is Omar Buddha. Omar, this is a conversation that our online audience have been wanting to have for a long time. What do you see?
It is indeed, and it's obviously a very major public health issue, and it's a scary one because a lot of people are actually dying because of this. So you see that reflected in our community as well. So we have here Mr. Will Bill tweets in saying the monster is out, and because African people are more mobile than ever, spread of the virus will be quick. And we have Mustafa here who says, why has Ebola been found in West Africa? Why is it incurable? What causes it? And what are its symptoms? So those, of course, are some of the questions that we're going to try to answer in this episode, and we want as many questions as we can from the community. No question is too small. This is an important issue, so we want to try to educate people on it. Be sure to send your questions using the hashtag AJStream, and we'll try to get to your questions during the show.
So we're talking about Ebola today because that's what you, our online community, wanted to hear. Have a look here on my laptop. You can see the number of people who said Guha Shah, Andy Haley, Joseph Nonyelim. They all wanted to hear about the Ebola virus. And if you've got an idea for us, a story idea that you think we really have to cover, just go to facebook.com/AJStream. Scroll down here and you'll find lots of spaces to comment, not only on just today's show, but also suggest a show of your own.
I'm Sister Rosemary, Sowing Hope in Northern Uganda. I am the director of St. Monica Gulf Tailoring Center, and I am in the stream.
The highly infectious Ebola virus has been spreading rapidly across West Africa, and what's now the deadliest recorded outbreak of the disease. Since March, at least 660 people have died, and more than 1,000 have been infected in Guinea, Liberia, and Sierra Leone. International health organisations have said they've been stretched thin, working with limited resources, trying to contain the virus. Medical teams are not only fighting a disease which has no known cure, they're also at odds with a public wary of trusting foreign doctors. And local suspicion surrounding even the existence of Ebola virus is deterring those infected from seeking treatment. In some cases, medical teams have been met with angry protests and violence. So what more should be done, can be done, to stop this deadly outbreak and keep it from spreading? To help us discuss this, we're joined via Skype from Monrovia by Tolbert Nyenswa. He's Liberia's Assistant Minister of Health. In Freetown, Sierra Leone, we have Omaru Fofana. He's a journalist who's been covering the Ebola virus. In Montreal, Canada, we have Mark Forget. He's a physician with Doctors Without Borders. He's just come back from treating Ebola patients in Guinea. And in Lima, Peru, Daniel Bausch is an Ebola virus specialist and an associate professor at the Tulane University School of Public Health and Tropical Medicine. Gentlemen, it's good to have you here in the stream. Daniel, I'm thinking if I'm watching this, if I might have relatives in certain parts of West Africa, Sierra Leone, Liberia, Guinea even, and I want to warn them about what symptoms they might have, how would I look if I was infected by the Ebola virus?
That's one of the problems, actually, that you would look not a lot different than many other infectious diseases that are more common, like malaria and typhoid fever, that start with fever and headache and some muscle aches. So that's one of our challenges, to identify early the people who have Ebola and pick.
Okay. All right, so that's one of the challenges. We're getting Mark popping in and out, but we'll sort out that audio in just a moment. Let's get rolling with our community questions. Omar.
Sure, we have a question that just came in from Akesili here, who says, mosquitoes carry malaria, so what carries Ebola? Daniel, do you have a sense of how Ebola spreads?
Yeah, we do. There's very good evidence these days that types of fruit bats are the reservoirs for Ebola, and they can infect people perhaps directly if they have contact with either a bat through hunting and eating a bat, or perhaps indirectly through contaminated fruit and things like that. Also, the bats can infect monkeys, and the people can get that from eating non-human primates.
That's interesting, Omar, because one of the comments that we got from our audience was, is a fruit bat, is that a one way of getting Ebola? And so Daniel's just confirmed that. So Mark Forget, you've just come back from Guinea. I want to get a sense of what the atmosphere is like for people out there, for doctors working in the region which is the most infected areas?
Well, I would, to put it short, I would say it's a bit complicated. It's complicated because it's difficult for us to explain to the population what we're doing, and the population in this part of the world is spread everywhere in the jungle, small villages. So we need to go and sensitize them and explain and about what's going to happen if they are transported to the treatment center, and also what we do and why we decontaminate their house afterwards, and so on. So there's a lot of resistance, and as you said before, even hostility towards the team. And whenever we cannot have access to a region or a village that where the Ebola strike, then we are one step back, and we can't respond very well. So the disease is spreading more than what we would like to.
Give us an example of how you actually explain to villagers what Ebola actually is. I'm looking here on my laptop and I'm seeing the virus here, but how would you explain that to a village in Guinea?
Yeah, well, we explain that it's a disease. First of all, we have to explain it to them that it's the first time because in West Africa it never happened before. So we have to explain how it's spreaded mainly, and that the contact, the close contact, whatever promotes the contamination and the chain of transmission needs to be stopped. So we have. So
you actually say chain of transmission, or how would you actually explain that? Because even I'm thinking chain of transmission. Does that mean if I touch Omar right now and he was infected, would I have Ebola?
Well, if he's infected and he's very contagious, let's say he has diarrhea and vomiting and that kind of symptoms, and you touch him and then you expose yourself greatly, yes.
What does expose myself greatly mean?
Come again?
What does that mean if I expose myself greatly? So I'm sitting next to Omar here, who we've just hypothetically given the Ebola virus. I've touched him. Then how do I get that from touching him?
Well, the virus that doesn't, as you said, it's a close contact. So, but what happens is usually people take care of sick people, so they have diarrhea, vomiting, and if some of them have hemorrhagic symptoms also as well. But even in their sweat and in body fluids in general, the virus is present. So, if you touch the skin of somebody and then you wash your hands afterward, usually nothing happens.
Okay.
But if you happen to eat after that, or you eat with sick people in the same food platter, for example, then you will get, if you get a few virus in, my understanding is that it will go fast and it will multiply inside you.
So
after
even
that,
a little bit,
you become a patient.
All right, so even a little bit of Omar's sweat, and I didn't wash my hands properly, and I'm eating a piece of bread and I get the virus that way, I could actually have the Ebola virus. That's kind of that's disturbing.
Yeah, it is. I mean, but what we think, I mean, maybe Daniel could answer better than I do, but definitely the amount of exposure is also a factor. If you are taking care of a sick person, or if you had the opportunity, I would say, to wash the body of a deceased, then your exposure is much greater, and then the viral load is probably higher, and then the risk of you having a disease that is fatal is also higher.
Wow. Okay.
So we have a skeptic here online that tweeted in saying, fact, 650 people have died from Ebola, 1 million from malaria, and over 30 million from HIV/AIDS. So how serious is it? Tolbert, let me throw that to you. How big a problem, can you discuss how big a health problem Ebola is in Liberia right now?
It is a bigger health problem. The reason I would say that, and in the region, the reason I would say that is the epidemic, the number of persons that have gotten infected in a very short period of time. This is what makes it a very, very serious public health problem in Liberia. As I speak to you, we are burying people on a daily basis, 4 or 5 persons. People are in community that we have to pick up, set up a burial team, set up an ambulance team to pick up sick people in the community, trying to even create a 60-bedroom facility right now to tend to patients. So this is a serious problem. And because of, as my colleague said when he explained earlier, looking at the fact that people taking care of sick people, people catering to dead people and playing with dead bodies, is further increasing the rates of the virus, and it is very dangerous. And if we are not careful in the region, the numbers might increase and will cause a serious problem. So it is a problem.
Mario, I'm looking at one of your stories that you filed recently, and it's about the Ebola virus. I know you've been covering this pretty extensively, and I clicked down from the picture. It says, "How to ignore a plague. Escaped Ebola patients besiege hospitals and deadly denial in West Africa." What are some of the biggest rumors going around about this virus that you're reporting on?
Well, essentially, from the start of the whole outbreak, there has been this message from health workers that Ebola has no cure. So as a result, people are asking themselves, if it has no cure, why do I even need to go to the hospital? Besides, there's a deep-rooted belief among people here that traditional healing is what they prefer to conventional healing. So they'll go to traditionally. And it has created a huge amount of problem in terms of people relating to going to hospitals to seek treatment when they have symptoms or show symptoms of the Ebola virus. Perhaps it's the biggest threat that this whole thing, people being either in denial or not wanting to go to hospitals because they have come along the Ebola outbreak, a huge amount of stigma. The moment they say you have Ebola, then you are stigmatized, and people dressed like people going to space, medics dressed in their full suits come around, and they come sometimes with police officers, and the entire family is quarantined. So that sense of imprisonment is something which has driven a lot of people away from showing out themselves, even when they show the symptoms of Ebola.
Sure. Have you seen any of the scenes where Doctors Without Borders, doctors trying to get into areas that are infected, they haven't been able to, or they've been driven back?
No, I haven't witnessed that myself, but I've had a lot of stories about it. I've been to Kenema, which is in the east of Sierra Leone, also hard hit by the outbreak, and I've had stories of people resisting, people entering or medics entering their premises to either have them tested or to have them observed or surveillance once they see suspects. That's one thing you'll see.
Maybe, Femi, I can make a small intervention here. Working with MSF, my main my main job was to take care of outreach. So, which means that basically we have alerts from the Ministry of Health about suspected cases in some communities, and we had to go there. And on a daily basis, we faced resistance. If it's not resistance, it's clearly hostility. People throwing rocks at not only MSF but also Ministry of Health authorities and other NGOs and the Red Cross also. So there's a big amount of fear and misconception about what's going on, and they just chase us because they don't know what's going on. And another link that is very easily made by population is the relationship between decontamination operations, because we go in the villages to decontaminate the house so people can occupy their houses again after that when it's decontaminated. So they see us, they see the teams spraying the house with chlorine, and then they made very quickly the association between the spraying and the spreading of Ebola, if I can say that. So it complicates everything, and there's a lot of misunderstanding about what we're doing, and since when people don't understand, they just chase us out. So
how do you Mark, how do you uncomplicate this if you're trying to help?
Let me jump in.
Go ahead.
I can jump in, right, from Liberia?
Absolutely.
Yes, this situation that he just described, we're having similar situation right now. As I speak to you, we are negotiating with MSF and Samaritan Purse, because these are the people the Ministry of Health is working with to contain the virus in our province called Lofa in the north, and in Mosurado County, as we speak, where I'm speaking from right now. The MSF team was torn out yesterday, the vehicle, and so they had to speak. The team have to flee from Liberia and move into Gegedu, where they slept last night, and try to put a bit and pieces together. They feel that they sprayed the chlorine that we're using as disinfectant to spray the dead person, go into the household that are infected, to spray the household chemicals that are killing them, and also they're seeing us as taking away the kidneys of their relatives, and so they are misconception and myths. So we have to go on the radio in the communities to explain that, look, this is something that we are using so that entire family don't get infected. So that's the problem.
So We have a lot of our online community also weighing in on reason why there's this mistrust of health workers. We have Mo Hassan here who says maybe locals feel that they've come to spread the disease. This is a mindset that is existent in certain communities, tales from generations passed down, possibly. So we're talking about conspiracy theories that spread. But on a more realistic note, Nyoko here says people are not getting enough sanitization about Ebola. People feel health workers could be carriers because they treat infected people. On this question, Daniel, given the fact that we're seeing doctors actually being infected with the disease, is this at all a concern that might be legitimate, that people who are around the disease, even if they're trying to treat it, could possibly be carrying it?
Yeah, I think you've lost my video, but hopefully the audio is still working. One of the things that was mentioned earlier, we shouldn't overestimate the
Okay, Daniel,
ability of this virus. It is obviously a very transmissible virus, an easy virus to catch from sick people.
Sure.
You're not kidding me? Yeah. So it's an easy virus to catch from sick people, but not from people who look well. So even someone who's incubating the virus, if you had contact with them, if they're not sick during that time, you're not going to catch the virus. So this being passed on from healthcare workers is not really a concern.
But healthcare workers
and also
go ahead, Tom.
The healthcare workers are into the treatment facilities. They are at the treatment units, so they are not the same as those going into the community to collect patients. Or if somebody is infected, the healthcare workers in the treatment unit are moving into communities. We use the spraying team, the sanitation team, the the ambulance team to pick up patients in the communities. The barrier teams will move in the community and pick up barriers in a very safe manner. This is why they use the chlorine. So
Toba, I hear that, and I hear this is a really important public service international announcement, but I'm also seeing headlines like this from The Guardian. Liberia, top doctor becomes latest Ebola victim. And then another one, heartbreaking one, from Sierra Leone. Sierra Leone's leading Ebola doctor contracts Ebola. Daniel, you know this doctor, Dr. Sheikh Omar Khan. What is happening when doctors and health professionals are actually getting Ebola and they know, well, we hope we know, how to protect themselves? What's going on?
Yeah, I've worked with Umar for over 10 years. So obviously there are ways to treat these patients, take care of them safely, and the usual garb that people wear that looks sort of like a surgeon is protective, but there are many other things that need to be there for protection as well. You need to have an appropriate amount of staff. You need to have basically all the support services, and in Kenema over the last month or so, those have just not been there. There's been a nurses' strike. We had times when we went into a ward of 55 confirmed cases of Ebola, and there was one or no nurses in the ward. That's not a safe environment, no matter what uniform you're wearing.
Sure. Omar.
So we have people also talking about how they can contain the spread of the virus. We have Drift Solomon here who says the Liberian who died in Nigeria was handled professionally. The government is now searching for those who came on the same flight with him. And then we have Yusuf here who suggests that one way to contain this is the imposition of travel restrictions and quarantine measures should be pursued as an option. Better late than never. Mark, do you have a sense of whether that's even realistic or even appropriate at all as a way to deal with the spread of this?
Well, I'm not sure if it's realistic. I mean, if you look at the way the disease spread earlier on, it was from one country to the other, but they were very proximal. So from Guinea to Sierra Leone and to Liberia, it's very easy to travel in that region. So I don't know if you shut down all the barriers or the roads that people stop moving around. I'm not sure it will be very efficient. People will find another way to move. And as far as airplanes and all the other movements, it would be a big hit on any economy, I guess. So I don't know if it's realistic.
Mark, I
think it also
the issue of restrictions, travel restrictions are just coming there from Sierra Leone.
Yeah.
I mean, when the first cases were detected in Sierra Leone, the government introduced some form of travel restrictions in Kalahun district, which is the epicenter. Schools were closed indefinitely, and travel restrictions were imposed. Even the open market system was also imposed, restricted, which affected the economy of the locals and all that. But then the question is, it has still kept spreading. And I hear just this morning, Arik Air, which is a Nigerian airline, has cancelled or suspended all its flights to Sierra Leone and Liberia. But the WHO is warning against international travel restrictions. Gambian president imposed a travel restriction. All flights emanating from Monrovia, Freetown, and Conakry were not allowed to fly into Banjul until a few weeks later. So we don't know. Probably people are saying that Gambia in a way to control it.
Sure. Let me just share with our audience something. Just give me a moment. I'm just going to jump in very quickly, and I'll hand it back to you. Let me show you a map here, so you can see what the issue here is. Here's Guinea. And the areas that you see in orange are areas where people are known to have contracted or have Ebola infection. The area which is sort of the greyish, greenish area, that is where maybe some suspected cases are. So we have Guinea here. Next door to Guinea, just south of Guinea, we have Sierra Leone. And then right next door to that, we have Liberia. And you can see here the areas of the orange where the Ebola virus is spreading. So trying to contain it, certainly right now, has been problematic. Go ahead. Who wanted to jump in there?
Femi, I'll jump in if I may. The travel restrictions, it's one component, but it's not realistic to think that we could really stop this through travel restrictions. The borders between those countries you just mentioned are extremely porous. You can close the road, but people can cross a kilometer down through the forest. And even with international air travel, someone traveling who's incubating the virus, there's no way to detect that. So simply implementing travel restrictions alone will not be effective.
Sure. Let me go back to Omar, because I know the community want to squeeze in another question.
We do have another question from OIO, who says, what are the hope of developing a vaccine in time to contain this deadly virus? Tolbert, do you have a sense of whether this is another thing that anybody's working on at this point?
I know there are a lot of research being going on for vaccine and cure, but I know also that there is no new license or new case of vaccine or cure right now. But there was rumors that somebody was in Monrovia giving vaccines and was using cola nuts. There's cola nuts called beta cola that people use in Liberia. There was rumors that it could cure Ebola. So we had to dispel that rumor that Ebola have no cure and there's no vaccine. So right now, I know there are a lot of research work has been going on. We've been talking to CDC folks to see what is going on and how we can figure that out. But there is no known license from WHO.
And the license bit is the important bit, because I also was reading on the WHO side about Ebola that there are some vaccines that are being tested, but they're not licensed to be actually experimented on people yet. I think maybe the headline for this story should be not necessarily 1,000 people have died in a few months from Ebola, but 400 people survived Ebola. I want to show you one here. He's an Ebola survivor, and he talks about what happens if you get treatment earlier, what potentially could happen. Have a listen to this.
J'ai été victime. Il faut qu'on voie ma face. La fièvre et Ebola, pour moi, je l'ai mis au même titre que les autres maladies. Rien ne peut m'effrayer sur cette terre, excepté Dieu. Et le secret n'est rien d'autre que pour celui qui atteint de ça, tu viens très tôt. Je suis venu. Ceux ou celles qui sont en train de faire nos traitements, on dirait les hommes qui vont dans la Lune, les cosmonautes. Si eux sont contaminés, qui va venir nous traiter? Si tu vas pour la lutte, tu ne vas pas aller mettre les bras ballants. Ce n'est pas l'habillement qu'il faut voir, mais l'objectif qui n'est rien d'autre que notre soulagement.
So, Amaru, let's go back to you spending a lot of time with just ordinary people in Sierra Leone. Give us that sense of what they're feeling right now.
You know, I spoke with two survivors, and it's amazing the numbers of those who have survived the virus in Sierra Leone. It's really high. It's confounded even some of the medics. So many people have been coming out surviving this thing. Generally, if this message had been sent earlier on, that Ebola is here, there may not be a known cure, but then, yes, some people can still be treated and they can get well. I would imagine that more and more people would have streamed into health facilities. Now, lots of these guys are coming out well, and like I said, I've spoken to some of them, and I think this is the best way of letting people know that indeed you can be treated and you can get cured of Ebola.
Wow.
That brought back some sense of hope in a lot of people that I was
a little glimmer of hope there from Umaru Fofana. We are taking all of our guests to the post show. Gentlemen, I'm going to take you all to the post show because we've only just got started, but thank you so much for the great information from Tolbert Nyenswa, Daniel Bausch, and Mark Forget. We are taking these Ebola experts to our post show at stream.aljazeera.com. Let me tell you about our next program before we go. What are the biggest issues facing Indian youth? Well, we speak to India's best-selling and often controversial author, Chetan Bhagat, about that. But right now, we're heading to the post show. But before we do that, I'm going to leave you with an education awareness song from Liberia about Ebola.
Protect your family. Protect your community. Cause Ebola is here.
people you're listening. Your please give me your ear. The thing they call Ebola, my people now la Latin.
Hello again, this is the Streams Online Post Show. We're talking about the Ebola virus outbreak in West Africa. Let's get right back to that conversation. I hate winding up the live show on the TV because just as I'm about to do that, I had 3 or 4 guests all piping up at the same time. Let me see if I can remember where we left off. Daniel, what did you want to add?
So I wanted to add that the terminology that's often put out there that Ebola has no cure, I think, is unfortunate because, as Umaro said, quite a few people have gotten better from this disease. We don't have a specific drug that hits against the virus, but getting into treatment early and getting good just general medical care can give people the best chance to survive, and many people do survive. So the term that there's no cure, I think, gives the wrong idea.
How do they survive? What happens to them? Have you looked at the people who've lived through it and said, oh, I know why they survived? It was because they were healthy or they had a good diet or what? How does that happen, Daniel?
We get some success stories from Liberia.
Yeah, go ahead, Tolbert.
Yes, I was saying we have some great success story from Liberia.
Okay.
Just on Sunday, we reintegrated a medical doctor that was working in our central region hospital from PB Hospital who was infected by the virus. He was taken to the treatment unit on time. We repeated his tests. He was negative and reintegrated with his family on Sunday. And we have had about 16 survivors now since the second wave of the outbreak. So if you come to the treatment center on time, you get palliative care, which is a supportive care. You know, the disease have sign and symptom of vomiting. We give rehydration. The disease have diarrhea. They stop the diarrhea. If they have headache, they give anti-headache. They give you medication. And if they are infection due to the virus, they give you antibiotics. And those kind of treatment with vitamin B complex and all that, you can recover, and this is what we've been doing in Liberia. So the language that it doesn't have cure, there is no known drugs that you can give. Like if you were giving malaria medication, the ACTs or the artemisinin-based combination therapy that will cure malaria, it's not the same as the Ebola virus to pick a drug and say, this is the first-line treatment for Ebola. I think this is the problem.
Femi, I can ask a question there. Hi, Femi.
Yeah, go ahead, Amaru.
Yeah, I just want to ask Daniel this because Tolbert has just raised a very interesting point there. And there is this notion that once you have survived a virus, you become immune to it. You'll never contract it again. So can I take it, Daniel, that once this doctor in Liberia has survived Ebola, he can no longer contract Ebola again, which gives him better ammunition to fight the virus? Is that true or misleading?
Right, I think we need to do that.
Oh, Tolbert, hold on 1 minute. I'm going to actually get a doctor to answer this question because that's a really important question. Daniel, if you survived Ebola, does that mean that you're immune to Ebola ever again?
Yeah, I think that's right. With the only exception meaning that there are different species of Ebola virus, but they circulate in different areas of sub-Saharan Africa. But I think once you get infected with one species of Ebola virus, and there's only one as far as we know in West Africa right now, if you survive that, I think you're immune for the rest of your life.
Wow.
So we have an interesting suggestion here that came in online. Tracy tweets in saying that 7 out of 8 patients survived back in 1995 by giving convalescent patients blood. Why is the World Health Organization hiding this fact? Mark, do you have any sense of whether this is actually true?
Well, I read the same article, I think, that your correspondent, that was done in DRC, Zaire at the time, and Zaire at the time, and it was on 6 or 7 patients only. So I think the number are very low, and I'm not sure if it was we were able to reproduce that. So yes, of course, it's a great idea, but there's other much better ideas in terms of treatment for Ebola that are going on around now. I mean, in terms of finding new cure, monoclonal antibodies, and so on. And
what does that mean, Mark? Sorry, do it in layman languages for me, so I understand what that actually means.
Well, I'm also not a specialist on this, but from what I understand, they're trying to develop an antibody exactly that would target only the virus of Ebola itself. So you could create that in the lab and inject it to patients when they start to have symptoms, and then you would get rid of the disease like any other. It would be a specific cure. As far as getting blood, blood is a big issue. We have to understand that if you try to get blood from people who survived and then give it to other people who are sick, that would need it would be a very extensive setup, and I'm not sure people would be agreeing on giving all their blood to save others. We see that in malaria projects and other projects that the resistance to give blood is already very high. So that was a one-shot deal. I think they tried in Congo at the time. I don't think it was reproduced anywhere else.
And Femi, that study in the Congo, most of the people, when they received the blood, they were past the average time to death for this disease anyways. So the thinking is that many of those people would have survived even if they didn't get the blood.
Right. Daniel, how do people die from Ebola?
People die from a process of basically losing too much fluid in their blood vessels through vomiting, diarrhea, other bleeding. And so when you don't have enough fluid in your blood vessels, you can't get the fluid to your organs that brings the oxygen and other nutrients, and their organs fail, and that's obviously a very serious and fatal situation.
So we have Abdul Baki here who tweeted in also saying, I think the MSF needs to work with educated members of locality. Chances of resistance are high if the MSFs are only whites and coming into these communities. Tolbert, has there been any consideration for this factor of sort of cultural factors for why there might be mistrust of international aid workers?
I think it's the fear and panic related with the disease and how people perceive the misconception and all that associated with the disease. So I don't think in our setting, if we look at the context of Liberia, I don't think because it's either white or black or it has nothing to do with race, because our people trust that something coming from a white person, they trust that, they want to see how we work in partnership. So race does not factor in here in the context of Liberia. I think we need to spread a message out there and tell. And
I would like to jump in for this. I'm sorry, but there's a misconception about the work of MSF, because there's not a lot of there's not only white people working with MSF, including the expats. You would have half of them that are black people from other African countries, and then they became expat, and they're sharing the work with us. So if you look at the different websites, you will see that. Also, MSF usually like in my project, we were about 25 expats, and we had 300 national staff. So the main workload is done by black people. So I don't think it's a big issue.
What about money?
Interestingly,
let's just be really candid here. So we're looking at Sierra Leone, Liberia, Guinea. These are places, I spent some time in Liberia. Everything is challenging in Liberia. Even going to somewhere that can treat you for malaria, it's very challenging. You get something like Ebola, how do you even cope with that? Tolbert?
It is really challenging because there's a thin line between the signs and symptoms of other diseases that are known in Liberia, like malaria, diarrhea, typhoid, and these signs and symptoms present as the same as Ebola virus disease. So the challenging aspect to that again is the health workers are afraid that they will get contaminated.
Right.
And so they reject patients.
But what about we've actually talked about that quite extensively, so we all get that. But what about money and the resources that a country like Liberia has to fight something like Ebola?
It has a challenge. The challenge is that
can you do it?
To equip, right? We need to. No, we cannot do it alone. But government is trying to put resources into this, and this is where the president is chairing a national task force right now. But we need international support to do this. Both technical support, financial support, logistical support is actually needed to help our little clinics, health centers that are around Monrovia and other parts of the country to get people to deal with this outbreak. So it is really challenging when it comes to money.
Femi, the reality is, if I could talk something here, the reality is, if you look at those regions in all three countries where the Ebola outbreak started, these are areas that have been neglected by all three countries. The border areas On that side of Guinea, if you go, it's like there's no central government leading them. On the side of Sierra Leone, it's like government has forgotten about the Kalon area. You go to Liberia and side of it, that's exactly what happened. And Ebola tried, particularly under a dysfunctional health system, which is what those three countries share almost equally in common.
All right, and barely any health systems, which makes us realize as an international community how much help these countries need. Gentlemen, I've enjoyed talking to you. I wish it was under better circumstances. Let me say thank you to our guests, Talbot Nyenswah, Omaru Fofana, Mark Fourget and Daniel Bausch. Thank you very much indeed. On the next show, a conversation with India's best-selling and often controversial author, Chetan Bhagat. I'll see you next time. Thanks for watching.